Well, hey guys, I'm Dr. Emil Tompkins, and today we're going to be talking about how to treat neuropathy successfully, and there are a lot of different factors. Now, much of neuropathy conditions are considered to be idiopathic, which means the cause of neuropathy really is unknown. Now, there are lots of research that gives a number of different causes. We can come up with hundreds of them. They're triggered by various different kinds of conditions and procedures. Diabetes, direct damage to nerves through trauma and continued pressure, alcohol consumption, poor nutrition, drug and chemical abuse, vitamin B12 deficiency, some autoimmune disorders, viral infections, medications, chemotherapy. There's so many causes, and considering that the cause of neuropathy is virtually undiscovered, a disease-based treatment a lot of times isn't applicable. So when I say it's not discovered, the one single underlying cause, because there's just so many things that do contribute to it. So then what you do then to really help someone with neuropathy is work on managing the underlying triggers, as well as making sure we do what we can to take care of the symptoms, which are things like burning or freezing pain, numbness, tingling, extreme sensitivity or loss of sensation. Those are the things that we have to make sure that we're doing. Treatment is also very highly dependent upon those kinds of factors. So, how do we treat neuropathy successfully? Well, let's talk about that. Number one, successful care takes a considerable length of time because the regeneration of nerve fibers can take a long time, 6 to 12 months or more. But there are factors that we know that if we follow them very closely, we can really make a difference in some of the things that you're dealing with. So, number one, managing the underlying trigger. Although there's not a disease-based treatment for neuropathy, its triggering factor may be. So we want to identify whatever we can as far as the underlying cause of that neuropathy. And if we do that, then that's a part of it. And so let's imagine this for just a second. Just to make it really simple, if diabetes is your cause, or you're pre-diabetic and blood sugar is an issue, and that's your cause, making sure that you fully understand that, get rid of the underlying trigger, which is the blood sugar problem, with nutrition, with certain supplementation. Some people have to look at medications and that sort of thing. That's something that you and your doctor can discuss. You put those pieces together, take care of that underlying process, that underlying trigger. Then we want to look at symptoms and do whatever we can to help symptoms. Opioid, non-opioid analgesics and NSAIDs are in some ways helpful, but their adverse side effects are pretty much unwelcome. We don't want them. Common side effects are stomach irritation, increased chances of bleeding, nausea, vomiting, headaches, tinnitus, a ringing in the ears, and in addition to that, most of these painkillers are toxic to the liver and the kidneys, particularly if you take them for more than 10 days. And we know neuropathy is a chronic, lifelong condition for many people. You're going to be taking it for longer than 10 days. And we don't want to damage the liver and kidneys. So we need a better way. And that better way is going to be attacking the pain at its source. And there are a lot of different ways to do that. One is with chiropractic management. Number one, we start with certain adjustments because the nerves, let's just imagine you have neuropathy in your feet. There's very specific nerve pathways that come out of L4, L5, S1, the lowermost part of the spine. And when those nerves aren't functioning well, then you're going to start to have negative effects in the way that the feet and the legs are functioning. So making sure that we're doing everything that we can to open up that pathway so that those nerves are functioning better. Guided exercises, other kinds of manual therapy are all part of the protocol to, one, promote mobility, and two, reduce pain. If the neuropathy developed following an accident or some other traumatic impact, there are micro tears in the muscles and ligaments that can cause tension buildup in the spine, and that can lead to blockages anywhere along the central nervous system. And those roadblocks are the cause of an abnormal transmission of the signals between the brain and the rest of the body. Or let's say the brain and the skin. If you have that tenderness, or that you get into bed and you put the covers over your feet and you have extreme pain, that is an imbalance in that communication pathway between the brain and those nerve endings along the skin. That's exactly why it's incredibly important, one reason why it's incredibly important that you're getting adjusted so that we're taking care of that area. Healthy diet, neuropathy can be supported through a highly nutritious diet. Again, if blood sugar is a problem, then we have to make sure we're managing our blood sugar, but it's not just that. You want to make sure that you're eating things that are going to promote less inflammation in the body. So many times we eat and do things that promote more inflammation. We've got to switch that around. We need less inflammation in the body. Our food can do that. Brightly colored fruits and vegetables and fresh leafy greens, B vitamins, rich foods like red meat, fish, shellfish, eggs, low-fat dairy foods, those kinds of things. Certain whole grains, and we talk about eliminating a lot of whole grains, but there are a few that are safe. Brown rice is really important. Quinoa is a whole grain that seems to not have as big of a problem on our blood sugar. So those are some things to consider. Number 4, exercise. Regular exercise improves muscle strength in people with neuropathy, and in some cases it can reduce pain. It also helps control blood sugar levels. One of the problems with neuropathy, because we have pain, we're then less active, and when we're less active, we get weaker. And the weaker we get, the more pain that we have. So it's this cycle that we can get caught up in. And if we get caught up in that negative cycle, then we could have pain forever. And that's the last thing that we want. And exercise helps control blood sugar levels. Especially for older people, exercise that puts emphasis on balance is an important component, because the worse the neuropathy gets, the less feeling you have underneath the feet, and the less feeling you have underneath the feet, the less balance you're going to experience, and your risk of falls and injuries are increased. So we focus a lot of our exercise on balance. And number 5, avoiding unhealthy practices. Guys, there are certain there are certain things that may sound a little too generic, but we know what they are. They're every unhealthy habit that we've indulged in, and all the excesses that are hard to let go, and that could be anything in excess intake of alcohol, excess intake of caffeine, excess eating or snacking when not hungry, skipping meals, smoking, not getting enough sleep, overusing painkillers, overusing sedatives, all these habits, and there are lots of them. You want to watch each of those things, because health is so much more than just making sure you're doing a healthy thing. You really want your body to function at its optimum potential, and if your body is going to function at optimum, you really have to take a lot of steps to be able to achieve that. And that is my goal for you, is to not just help you to feel better, but to really give you the tools that it takes to truly improve your health, to truly improve your neuropathy. Clearly, as a result of this video, you see there are things that can make a difference in your neuropathy. And so when we put these different pieces together, not only are we removing the triggering factors, we're going to strengthen your body's ability to fight the neuropathy and heal. And these, all these things are natural, that aren't going to have a ton of side effects. Now, these things that I'm talking to you about are a part of our FFA method for neuropathy treatment. And what we do is we focus on very specific areas: how we're fueling the body, how we're improving blood flow, how we're activating nerves. And when we put those pieces together over time, we can see those nerves heal. It takes time, it's not easy, it's a process, but neuropathy can change for the better, and that's my goal for you. Hey guys, I'm Dr. Emil Tompkins. If you're here in Southern Arizona, contact our office so we can sit down and talk more about how we can help you with your neuropathy. If you're not in Southern Arizona, stay tuned on this page. We're constantly putting out information that's going to help you to be healthier, and look out for our online program called the Neuropathy Notebook. Hey guys, we'll see you soon.